This video is a fourth in a series about finding your new home after 50. In this episode, we'll cover senior living options and how to assess these options. As noted in an earlier video, the state of your health might dictate the location for your next move. After a frank health assessment, you can decide which alternative makes the most sense for your situation. The main options are independent living, home health care, adult daycare, assisted living, skilled nursing care, and memory care. Let's take a look at each of these in more detail. First, let's look at independent living. Independent living is defined here as living arrangements that the 50 and over crowd move to from their family home. It can include single-family homes, townhomes, apartments, or condos with or without care services, and continuing care communities that provide a progression of services from independent living to assisted living to skilled nursing or memory care. The chief reasons people move into such arrangements are less stress. Many of these senior living settings allow residents to escape the responsibilities of a traditional home like yard work or home maintenance. Some have dining options, so cooking for oneself is optional. In addition, most communities are constructed with senior accessibility in mind to deliver greater convenience and safety. Active lifestyle. With less responsibility at home, there's more time to pursue other pursuits and hobbies. Social interaction. When surrounded by other residents of a similar age and circumstance, the options for connecting with people increase. In many communities, planned social activities are a part of the daily routine. And healthcare availability. Depending on the community, healthcare services may be built in as a part of the overall value proposition for residents. Next, home healthcare. According to a 2021 AARP study, 77% of seniors want to age in place in their homes. As a result, the interest in home health care has grown. Both medical professionals and insurers increasingly support home health care as an effective yet lower-cost method to support patient health. This form of care can deliver various medical services and, in some cases, assistance with daily activities, housework, or transportation. The availability, cost, and quality of home health care services in your locality may be a significant factor in deciding whether or not to move. Next, there's adult daycare. Some of us may opt to live with family for health or well-being. While this can be a positive arrangement, it can cause stress on caregivers stretched thin by their responsibilities. Adult daycare provides an opportunity for adults with extra needs to spend daytime hours in a safe, supportive atmosphere. Adult daycare services vary in the services they offer, like social interaction, medical support, or dementia care. Next, there's assisted living. Located in a facility outside the home, assisted living arrangements provide housing, social interaction, medical support, and help with daily activities. Accommodations range from private apartments, private rooms, or shared quarters. The facilities typically strive to create a feeling of home and are set up to promote resident independence. Services normally include meals, medication support, housekeeping, and laundry. In addition, some facilities offer enhanced assisted living, which includes some higher levels of medical care that would have otherwise been available only in a skilled nursing facility. Next, skilled nursing care. For those who need a higher level of medical support, skilled nursing care facilities provide services at a level below an acute care hospital. Skilled nursing care can be short or long-term. Short-term stays focus on helping patients recover and rehabilitate after a hospital stay. Long-term care focuses on those with chronic conditions requiring around-the-clock medical attention. Unlike short-term patients, those requiring long-term care rarely return home. Finally, there's memory care. Patients requiring memory care may be healthy in most other ways, but the effects of dementia make it unsafe for them to live in the community. Dedicated memory care facilities are designed to support resident safety and well-being. These facilities typically provide private or semi-private rooms, meals, medical and location alert systems, housekeeping and laundry, assistance with daily activities, and social recreational activities. In addition, memory care may be offered at some assisted living or skilled nursing facilities in specially designated areas within their buildings. As mentioned before, your health status will determine which type of senior living arrangement is right for you or your loved one. Once you choose the type of senior living arrangement, how do you determine which one is right for you? Here are some guidelines for determining if the particular option is the right fit. First, finding information. Once you've decided on the type of senior living alternative, how do you find out what's available in your area? The easiest way to find possible choices for consideration is an internet search. Also, there are websites like Cantissimo Senior Living that have in-depth curated information about various options. Another tactic is to ask friends and trusted professionals like doctors or attorneys for their recommendations. Next, after reviewing the websites of potential candidates, narrow the field to 3 to 5 top options. Follow this up with initial phone calls to each location. The person in charge of admissions will answer basic questions and learn more about the prospective client. Taking a tour. Armed with a final list, arranging facility tours comes next. For home health care, this means a visit by the home health care agency to the house to meet the prospective client and tour the residence. If you are visiting a facility, make a list of questions and take notes as you go along. Don't be afraid to dig in for as much information as you can, because this is a big decision. The prospective resident client should participate in the process. His or her buy-in is crucial. Otherwise, the transition to senior care could be a disaster. Location. This applies to situations aside from home health care. On the drive to the building, notice proximity to the homes of loved ones. Is it an easy drive all year round? Is the neighborhood pleasant with stores and services nearby and is safe to walk outside in the area? Is it in a noisy, bustling location or in a quieter setting? Now for the building itself. If you're visiting a facility, note the parking situation to see if there's enough spaces for visitors. Does the building strike you as well maintained and attractive? Are there safe and pleasant areas outside the building for residents to sit or walk? Next, take note of the interior spaces. Does the lobby feel welcoming? Are the common areas open, well lighted, and uncluttered? As you walk through the facility, is the layout easy to follow? Are appropriate safety measures in place, like handrails in the hallways and grab bars in the bathroom and non-slip floors? Next, there's policies. All senior facilities and home health care agencies have policies that are important to know. Therefore, make sure to get a complete list of policies during the visit. Living quarters. Typically, assisted living quarters are considered to be apartments. They can be studio efficiency or 1 or 2 bedroom apartments. For skilled nursing care, private or semi-private rooms are the norm. Inspect all room amenities such as kitchenettes, closets, and bathrooms. Residents. On the tour, note how the residents appear. When touring the building, take note of the residents. Do they appear clean, well-groomed, happy and comfortable? Are they socializing? How about the staff? How do staff members act during the tour? Are they professional, friendly, and knowledgeable? Ask about staffing levels, because finding competent workers is a problem these days. Also, what is the plan for the staff to communicate with the resident's or client's family? Care plans. In all senior living alternatives, there should be a care plan for the resident or client. This document defines the details about care to be delivered. Ask for a sample care plan so you can know what it includes. Contracts. Signatures on contracts will be required for services to commence. Carefully review the agreement to fully understand the financial and policy implications of service delivery. Financial. You will pay for services via insurance, out of pocket, or a combination of the two. The services contract will specify your financial responsibility. Some people run out of money during the delivery of services and switch to Medicaid insurance. If that is a concern, make sure you understand the details about how that coverage transfer works. Medication and healthcare. A major goal of any senior living arrangement is maintaining the resident client's health, so quality of care ranks high in importance. Closely question the staff about how health services will be delivered. Dining. Each senior living alternative includes a food service component. Even home health care can have meal prep as a service, and adult daycare serves meals. Sampling meals can provide insight to food quality. Activities. Stimulating activities should always be a part of the senior living experience. A varied list of interesting activities and events leads to greater happiness and well-being for residents and clients. Ask for samples of activity schedules. And finally, transportation. Does the facility have its own transportation program? For home health care, are aides able to transport clients to the store or doctor appointments? Ask if transportation costs extra and if drivers are fully trained and insured. It's important to assess all aspects of the senior living arrangement. Ask a lot of questions and gather as much data as you can. However, your own intuition can be a good guide. The arrangement needs to feel comfortable for the resident, client, and the family because finding the right fit will hopefully lead to a satisfying experience for all involved. I hope this video about finding your new home after 50 has been helpful. In the rest of this video series, we'll cover more things to think about as you consider your next new adventure in life.